Here is the art of hair transplant restoration surgery on an African American man who has a receding hairline in the corner. Our goal is to recreate his hairline and to build his hairline the way he had it before. And as you know, on average, from the mid eyebrow to the hairline is around 6.5 to 7 for black men and for Asian men, and for Caucasian men is around from the mid eyebrow to the hairline around 7.5 to 8.5. Again, that's the average height. We use the average height of each ethnicity as a guide, but really, when we build the hairline, we build it according to each individual facial structure. And the reason is this: when we build the hairline, we want to make sure that each individual will be proportional to the overall face. But as long as it's a third, from mid eyebrow to the hairline, it's a third, mid glabella, tip to nose, a third, tip to nose, bottom chin, it's a third. And hair transplant, especially the hairline, is an art form. Require a lot of the artistic and aesthetic detail to ensure a very natural result. So, you know, for black men do not have an arched back hairline like the Caucasian man. As you can see, most black men has a nice curve, straight across, and at the height it's around 6.5 to 7. As you know, I'm one of the very few hair transplant surgeons who specialize in the art of restoring black man hairline and using the FUE method. FUE is Follicular Unit Extraction. Pulling one root at a time, leave your minimal scar, allow you to wear your hair shorter. FUE is what I recommend for most black men. Why? Because most black men like to wear their hair shorter, and if you do the strip method, it will leave you that linear scar, and the linear scar is permanent for the rest of your life. Where the tiny dots, it is visible, where FUE scar, tiny dots of scar, allow you to wear your hair shorter, because the tiny dot scar is scattered through the back like a mosaic pattern. It's hard to see. Again, FUE is the future: less invasive, less bleeding, less chance of infection. Against the artistry of the hairline, once we get the height down, we're trying to go straight across. And then the zigzag is different from other ethnicity. The African American man zigzag is smaller in amplitude versus Asian Caucasian was bigger in amplitude. Why? Because most African American men like to line the hair straight up anyway, so if you do such a big zigzag, then the hairline is higher. The other important factor is the angle of the hair is flat against the skin, more like 15 degrees, versus Caucasian men and Asian men is around 35, 45. And then not only the precise angle is important, selection hair graft is important. We try to find rows and rows of single hair graft in the front, followed by root of 2 hair, 3 hair, 4 hair in the back for bulk and volume. So this is the art of hair transplant restoration surgery on a black African American man with a receding hairline corner. We'll be attempting to do around at least 1,500 grafts. Thank you. By the